In the name of Allah Almighty, who is the most merciful and beneficent. Assalamu alaikum. My name is Safa Nadeem and I am from BS Biotechnology Department, and I am going to present the topic which is artificial sweeteners. Contents include introduction, ingredients used in artificial sweeteners, purpose, aspartame, sucralose, artificial sweeteners for diabetic patients, difference, reference. So let's get started. Introduction. Artificial sweetening agents are basically those chemicals that sweeten food. They are usually harmless for our body. They do not add calories to our body. The examples of artificial sweeteners include aspartame, sucralose, and aspartame, etc. Ingredients used in artificial sweeteners. Artificial sweeteners are made with sucralose and saccharin. The predominant ingredient is water. Flavor, preservative, or both are often added to improve taste and maintain freshness. Artificial sweeteners is basically used to improve taste and maintain freshness of food. Purpose. Now we are going to discuss about the purpose for which the artificial sweeteners are used. Several artificial sweeteners are used to give diet soft drinks a sweet taste without sugar. They are used in the place of sugar. That is why it is called sugar substitutes. They provide the sweetness of sugar without added calories, reducing the risk for obesity and dental cares. Aspartame. Aspartame is an artificial non-saccharide sweeter, 200 times sweeter than sucralose. Sucrose is basically the natural sugar which we use in our daily life, commonly used as sugar substitutes in food and beverages. It is used in the place of natural sugar in foods and beverages. It is safe for the people when used in moderation. The formula of aspartame is C14H18 and 2O5. It is not used in the preparation of sweet for diabetic patients as it can decompose at high temperature. Sucralose. Sucralose is also an artificial sweetener and sugar substitute. The majority of ingested sucralose is not broken down by the body, so it is non-caloric. It is about 600 times sweeter than natural sugar. More than 100 safety studies representing over 20 years of research have shown sucralose to be safe when used in moderation. The formula of sucralose is C12H19Cl3O8. Sucralose is almost certainly safer than aspartame. This is the reason sucralose is used in the sweets of diabetic patients. Now we are going to discuss about the artificial sweeteners for diabetic patients. They are safe for the people with diabetes. They can be used to reduce both your calories and carbohydrate intake. Sugar substitute also can help curb those cravings you have for something sweet. It cannot increase your calories. Uh, this is the reason we use artificial sweeteners in the place of natural sugar. Saccharin and sucralose are used in the preparation of sweets for diabetic patients. As I already mentioned, aspartame is not used as it can decompose at high temperature. Saccharin is 550 times sweeter than natural sugar, while sucralose is 600 times sweeter than natural sugar. Aspartame is also not used in the preparation for sweets of diabetic patient as it is 2000 times sweeter than natural sugar. As you all have seen your parents or grandparents using this in their teas. The reason is that it is with low calories and it is safer for their health. Now we are discussing about the differences between natural sweeteners and artificial sweeteners. Sweeteners. Natural sweeteners are more expensive than artificial sweeteners. Natural sweeteners are associated with more health benefits. Examples include date, honey, coconut nectar, etc. Point number 4 is fructose and sugar alcohols are the main sweet taste compounds. Fifth one is uses include baking, spreading on bread or biscuits, sweetening various beverages, and preserving meat. These are the uh, differences of natural sweeteners. Now we are going to discuss about the artificial sweeteners. Artificial sweeteners are cheaper than natural sweeteners. Artificial sweeteners may have adverse health effects. Examples include aspartame, sucralose, advantame, neotame. Amino acids, peptides, and sugar alcohols are the main sweet taste compounds. Uses include sprinkling on food, sweetening hot drinks, and texture to cook products, etc. These all are the differences between natural sweeteners and artificial sweeteners. Now we are going to discuss about the disadvantages of artificial sweeteners. So let's get started. Point number 1 is artificial sweeteners have linked to diseases. It is quite shocking and horrible at the same time, but many studies have shown its link to the diseases. Along with the other diseases, they are linked to, to the uses of artificial sweeteners. It also includes the possibility of some form of cancer. Point number 2 is harmful chemicals can causes indigestion. Our body has a tendency to handle any kind of natural reaction. Some Some artificial sweeteners are mostly man-made chemicals that are not found in nature. Some chemicals can be harmful to human body. Point number 3 is increases level of sugar craving. As we all know, some are really not sugar. This could not satisfy most of your sugar cravings. This may lead to overeating because we keep eating until we get satisfied. Point number 4 is weight gain and obesity. There are many studies that give evidence of what they are causing weight gain and obesity. Intake of artificial sweeteners increases your body mass index and body fat percentage. Point number 5 is type 2 diabetes. Artificial sweeteners increases the risk of developing type 2 diabetes. According to the data from Nurses Health Study, the risk of type 2 diabetes is amplified in those who consume at least one artificial sweetened drink per day. Point number 6 is hypertension and heart diseases. The risk for heart diseases has significantly increased in women who consumed more than two artificial sweetened drinks per day. Artificial sweeteners have also disadvantage of increasing the risk for hypertension. These all are disadvantages of artificial sweeteners. Let's conclude this topic. It is well known that high consumption of sugar is dangerous for health, and artificial sweeteners may even make worse than negative effect of sugar. That's why It might be enough to take a small amount of things that are natural than gaining high amount of things that are artificial. So hope you understand this topic. Thank you so much for your attention. These are the references. Have a nice day.